Hello, future PTAs. Hope you guys are doing well. Today we're going to talk about superficial cold and heat. Here is our outline of what we'll talk about with cryotherapy or cold and thermotherapy or heat. So we'll start out with cryotherapy. So the effects that cold has on the body, the hemodynamic effects, initially it does decrease blood flow. The neuromuscular effects, it decreases nerve conduction velocity, increases the pain threshold, so it can help you have less pain by increasing the threshold, alters muscle strength, decreases spasticity, and it can facilitate a muscle contraction, especially like that cold spray or some type of quick cold. And it has metabolic effects such as decreased metabolic rate. How it decreases blood flow. So it decreases the temperature, so that stimulates the smooth muscle contraction of the blood vessel wall, so vasoconstriction. There's a decrease in the release of vasodilators, such as like histamine and prostaglandins, things like that. And it activates the sympathetic adrenergic neurons, which cause vasoconstriction. All three of these together results in vasoconstriction, where the blood vessels are smaller and they decrease blood flow to the area. The cold-induced vasodilation. So we talked about this in class 7, but essentially if you leave cold on too long, the body is like, uh-oh, we need to protect ourselves. Let's actually dilate the blood vessels to increase blood flow to this area so that it doesn't die, so that we don't lose this body part. So if cold is applied for longer periods of time, when the temperature reaches less than 10 degrees Celsius, which is 50 degrees Fahrenheit, vasodilation can occur. This most often happens in distal extremities, and with the application of cold below 1 degree Celsius, which is around 33.8 degrees Fahrenheit, for longer than 15 minutes. So if we're putting ice that's below that, below 1 degree Celsius, it's below freezing, then if we're putting ice on an area, we don't typically leave it on more than 15 minutes. Usually I'll do about 10 to avoid causing vasodilation. I forgot to say something on this slide, so I'm going back to it. So we talked about first vasoconstriction with ice and then vasodilation. Well, with the vasoconstriction, the theory is that the reason that there is vasoconstriction is the body is constantly trying to keep homeostasis. It's trying to maintain a constant core temperature and blood pressure and all the different things to reach homeostasis. So in order to maintain a constant or a consistent core temperature, is that when an area has ice on it, or when one area is colder than the rest, that the blood flow to that area is constricted or decreased to decrease the effect that it has on the rest of the body. So if less blood is circulating through that area and back to the heart, then that cold blood isn't constantly being pumped and making the rest of the system colder. It's just making that one area colder. So that's the thought behind why the blood flow is restricted in an area that's cold, or the vasoconstriction happens in order to help the body maintain that consistent core temperature. Some of the neuromuscular effects of ice or of cold: decrease nerve conduction velocity. This is to sensory and motor nerves. Decrease the sensation of pain and increase the pain threshold, so it takes more pain before your brain interprets it that way. Alter muscle strength. So cold therapy has been associated with both increase and decrease in muscle strength, and it depends on the amount of time that you have the cold or the ice on the area, and then the length of time between taking it off and doing whatever measurement of strength. So depends on when you ice, how long you ice, and really what you're doing and what you're using it for. Ice can decrease spasticity and it can facilitate muscle contraction. So again, depending on how long you use it, it could decrease the muscle contraction or it could increase the muscle contraction. So we can use it in different ways. The metabolic effects of ice. It decreases the rate of all metabolic reactions, including inflammation and healing. So it can be used to control acute inflammation, but it's not recommended when the person already has an issue with healing. When healing has already been delayed, then ice is not recommended. What cooling does, it decreases the oxygen hemoglobin dissociation, which means there's less oxygen available to the tissues. One thing I do want to mention is if you have a patient who's had a PRP injection, that's a platelet-rich plasma, PRP, platelet-rich plasma, typically, at least in the first 3 days, some physicians will say don't at all, but you are not going to use any type of ice or cold therapy on that area where they got an injection because the treatment is actually intended to cause inflammation, and that is intended to promote healing. And if you then ice and decrease that inflammation, it doesn't work as well. So if ever you have a patient that's had some type of PRP injection, it's kind of common for someone to get it in the shoulder or something like that. Do not use ice, at least for the first 3 days. And if it's indicated on their chart not to use ice for however long, then follow that for sure. Clinical indications for cold therapy. So to control inflammation, which is also edema, to control pain, to help with spasticity, which may take longer durations of ice, to help manage symptoms, not only pain, but like in certain things like MS or people who have trouble regulating their temperature. It could be used to help with that. This is actually a cooling vest in the picture that someone could use if they're having issues with either hot flashes or with frequently getting too warm or overheating. And it can help in people who have MS or multiple sclerosis. And then for facilitation. In inflammation and edema control, rice is the best thing. I know that it doesn't take a lot of school to know rice. A lot of people already know it, and that's great. It's good that it's been spread around and people are starting to know that that's what you do for an injury, but just because it's old and it's simple doesn't mean it doesn't work. I have told people time and time again, they call and they say, I have blank going on, what do you recommend? I'm like, rice. Typically pretty safe. So rest, ice, compression, elevation, and remember that the elevation is above the level of the heart. So unfortunately, the rest of his body got cut off, but if he is sitting up with his leg like this, even though his leg is propped up, if he's sitting upright, then his heart is still above the leg. So he would really need to be laying down with his foot up high like that to help for it to really be considered elevation, because the area needs to be higher than the heart so that gravity can push the swelling and the extra fluid back to the heart. So that's something I run into a lot in home health. Somebody's had a knee replacement and they have their knee propped up on pillows, but they're sitting straight up on the couch and they think that they're doing a good job, but they're like, I just can't get this swelling to go away, and I've been sitting with it propped up ever since the surgery. Well, you've been sitting upright. Your heart is still higher than your knee, and so it's not actually helping. So they would need to really lay down, or at least, be in a recliner or something and prop it up a little bit higher for that body part to be above the heart to really help decrease that inflammation. Some of the contraindications and precautions. I need you to read these and be familiar with these and understand them and know them and be ready to be tested on them. So this, I'll read it to you quickly, but you're going to have to spend some time actually learning it. There's quite a few, but you need to know these front, back, side to side. I like to say that, but I don't know that it makes sense, in every which way. Okay, so the contraindications. If they're hypersensitive to cold, you don't want to use it, or intolerant, which is about the same thing. This cryoglobulinemia is a rare blood disorder causing blood to clot at cold temperature. So you don't want to cause their blood to clot. This paroxysmal cold hemoglobinuria, okay, I'm probably not saying it exactly right, but it's a rare autoimmune disorder. The body attacks red blood cells in cold temperatures, so you also don't want to cause that. Raynaud's syndrome, it's a little more common. I've had several patients with Raynaud's, but I haven't had patients that have ever told me or had written in their chart the other two. And this Raynaud's syndrome or condition is a condition that causes reduced blood flow to the distal extremities, usually the fingers and toes. And typically they'll turn kind of white and feel cold, and it may not even be at very cold temperatures, but if already they're having trouble with the blood flow not being kind of either restricted in those areas, then you don't want to restrict it more. And then if a peripheral nerve is regenerating in an area, you have to be careful about knowing that. How do you know that? I would definitely look in the chart and see like what type of surgery they did and if they had any notes about anything like that. Not something that I've come across a lot. That's something that I'm not sure you would always know, so just be cautious about that. And then areas where the circulation is compromised. If already there's decreased blood flow to the area, you don't want to decrease it more. Precautions, a superficial main branch of a nerve. So be careful where you're icing. Like most people do not like, and I wouldn't necessarily use ice right over the spine. Like I'll use ice sometimes in the low back. Usually it's more so heat than the other, but almost never in the neck. There's all those nerve branches up there, and patients don't tolerate it. I never really use it in the neck. But you could use it like over one shoulder, like maybe if it's the upper trap or something, or even over both shoulders, but I wouldn't just wrap it around the neck. An open wound, because of course you could slow that healing time down. Hypertension, so that's just going to be dependent upon the patient and if they're having symptoms at that time or what exactly. When you cause vasoconstriction, it increases the blood pressure. If, of course, you're just doing it in one area, like a hand or something, that's one thing. If they were going to do an ice bath or something more extreme, it may not be safe. So that's why it's a precaution and not a contraindication. You have to use your own judgment to decide if it's safe or not. If they have poor sensation, poor mentation, and can't tell you if it's too cold, or if they're extremely young or old, because if they're older, their skin might be fragile or more sensitive. So all those you use your clinical judgment on. All right, some of the effects of cryotherapy or ice or cold therapy. Tissue, death, or damage. Now this is if it's left on too long, so this is something you have to really watch for. This is not one of the effects we want. And it typically occurs when the tissue itself reaches 15 degrees Celsius or below, and that's 59 degrees Fahrenheit or below. And earlier we had, in another slide, it said 50 degrees Fahrenheit or below. So just be really careful. If it's really red, once they say they're frozen or once a timer for 10 to 15 minutes goes off, I don't leave it on. But it's good to check maybe 5 minutes in and look how red it is and ask them how they're feeling and things like that. Freezing or frostbite occurs when the tissue temperature is below 4 degrees Celsius, which is 39.2 degrees Fahrenheit. So you definitely don't want to cause any of that. If it is significantly red, then I would go ahead and take the ice off. A little redness is kind of to be expected, but if it's really red, I would go ahead and take it off. Always keep tissue above that so that you don't cause any frostbite, and never apply ice, I would not, more than 45 minutes. Now, it's interesting because we have these like game ready machines where we keep like a steady flow of cold water that's sitting in ice on an area for the first day or two after surgery. Typically it's used, I see it most often for knees. Occasionally it'll be for something else. And most of the time within the first 2 days after a surgery or a severe injury, you can use ice more frequently, but I would still recommend every 30 to 45 minutes, take the ice off, take a break for 30 minutes or so, maybe even 15 would be okay. let the tissues warm back up before you put it back on. But in a normal situation where it's not just an acute injury or the day or two after surgery, I don't ice more than 10 to 15 minutes. I personally don't do more than 20. So 45 is the number you need to know and be aware of, but I don't do typically longer than 15. Application. So first we evaluate the patient. We determine if they're safe to have ice. We inspect the area and remove any metal, because remember, metal gets cold faster than other things like skin. And then we apply superficial agents. So the superficial ice modalities are cold pack, ice cup, controlled cold compression unit, vapocoolant spray. Then you prepare the patient by telling them what you're going to do and positioning them. You apply whatever agent you've chosen, you assess them, and you document what you found. The things that you document include the treatment area, what agent you used, how long you used it, treatment duration, patient positioning, and the response to intervention. I feel like I skipped a slide. Let me just make sure I didn't. Maybe it's later on. I have a slide that has like a cold fence, and it's talking about metal being more cold. Oh, that was in the last PowerPoint. Okay. When you do a lot in a day, sometimes you just forget your stuff. Forget what you're doing. Okay, that was in the last PowerPoint. I already covered that. Just wanted to make sure I didn't forget. But we did already talk about metal conducting the thermal agents like cold or heat faster than some of your other materials, and so you have to be really careful to take off metal before you heat or ice an area. All right, now we're talking about heat, thermotherapy effects of heat. So the hemodynamic effects cause vasodilation. Neuromuscular effects, changes in the nerve conduction velocity and the firing rate, increase in the pain threshold, just like ice did, change in muscle strength, an increase in the metabolic rate. Remember, the ice decreased the metabolic rate. Here we increase tissue extensibility. So here we have a muscle that is at rest, and then it's shortened like a muscle contraction, and then it's lengthened like a stretch. And when you heat up an area, then it allows it to lengthen further. Why the heat causes vasodilation? First, there's a reflex relaxation of the smooth muscles of the blood vessels. So when they're relaxed, they open up and allow more blood flow. That's what vasodilation is. An activation of local spinal cord reflexes that cause vasodilation, a release of chemical mediators. These are histamine and prostaglandins. Again, same ones that were affected by ice. With ice, there is an inhibition of these mediators. With heat, there is a stimulation of these mediators. And then a decrease in sympathetic output. So with ice, the sympathetic output causes vasoconstriction. Here, the heat decreases that output so that there's less reason for it to vasoconstrict. So all of that together creates vasodilation, the opening up of blood vessels to increase blood flow. Clinical indications for heat, so pain control, accelerated healing, and increased range of motion are your main three. With pain control, the heat can help with the pain gating. It can help decrease muscle spasms, which cause pain. It can reduce the ischemia, which is a lack of oxygen in an area, by increasing blood flow, and it can accelerate healing. I have this beautiful heart here because it was so pretty, but I was trying to look for pictures of ischemia, and it just wasn't working out for me. So this is just to remind you that it increases blood flow to increase oxygen to the area, so that reduces ischemia. Some of the other indicators, so I talked about increased range of motion and decreased joint stiffness. When tissue temperatures are between 104 to 113 degrees for 5 to 10 minutes, it increases the soft tissue extensibility. So if you apply a low load prolonged stretch during heating and while cooling, will then increase tissue length safely and effectively. I didn't realize it said and while cooling. This was directly from the PowerPoint from your book, so I'm not sure about the and while cooling part. I'll look back and see how to explain that part in a minute. But if you heat up an area and then you stretch the area either while you're heating up, I was trying to find pictures of somebody with heat on it while they were stretching their hamstrings, but I couldn't find any, then it helps increase the muscle length even more. This is like a hot yoga class, and the theory behind that is the heat increases the tissue extensibility, and then if you're stretching while you're at an increased temperature, then you're using that length and helping get to a new length. Here are the contraindications and precautions for heat, for thermotherapy. Hemorrhage, if somebody's already bleeding, you don't want to increase their blood flow. They'll just lose more blood. Thrombosis, that is a blood clot, and if you dilate the blood vessel, so like let's say there's a blood clot in this blood vessel and it's stuck, and then I open up the blood vessel, now it's free to move, and it can move to the heart, cause a heart attack, to the lungs, to cause a pulmonary embolism, to the brain, to cause a stroke. We don't want any of that. Or in another vessel, it would be a deep vein thrombosis, so we don't want that. If their sensation or mentation is impaired, just like with ice, then you don't want to use heat and not know if it's causing issues. If there is cancer in an area, you do not want to use heat because it can stimulate cell growth or proliferation, like spread the cancer essentially. And then with infrared, the radiation of the eyes. So with infrared, if there is any exposure up towards the eyes, then they need to have protective eyewear on, or you need to keep it away from the eyes. Some of the precautions with heat is acute injury or inflammation. Typically, we do not use within the first at least 48 hours, but I personally go for like the first week after an injury. I typically don't use heat. Now, sometimes I'll just say when people have like a muscle injury, like they've pulled a muscle, they want heat day one, and like they'll do it on their own at home, even though I'm telling them not to, and sometimes they get relief from it. So I can say there are some situations where somebody might benefit from it. I don't use it in the clinic within the first week after an injury. Pregnancy, impaired circulation, swelling, because you'll make the swelling worse, cardiac insufficiency. Now, the reason for that is the heart is already overloaded, and if you increase blood flow, you're going to overload it more. So you're just going to make the problem worse. Over metal, you don't want to. You could burn the area. Over open wounds, over topical counter irritants. So if they have some type of ointment or something on their skin that the heat could irritate or cause some type of reaction, you either don't use it over that, or you clean the skin really well, wash it with soap and water, and get that off before you put the heat on. And a demyelinated nerve. Now that's going to cause impaired sensation, and so that's why you wouldn't heat over a demyelinated nerve. Adverse effects of thermotherapy: it could cause a burn, it could cause fainting, it could cause bleeding, it could cause skin or eye, not sky, damage if you're using infrared radiation. But so because of this is what I'm saying, you want to, number one, pay attention to their signs and their symptoms and all the things you need to know to determine before you put heat on if it's safe, but also assess throughout. So you've put heat on, don't just leave them there the whole 10, 15 minutes that you've decided to heat them. One, give them a call bell. If it gets too warm, call me, but also go back after a few minutes, at least within the first 5 minutes, and ask, how is it feeling? And then kind of raise up and look at the area. Is it getting too red? See if you need to put extra layers or if you need to just discontinue it altogether. We basically do the same application for heat as we do ice. We first evaluate the patient, determine if it's safe. We inspect the area and remove any metal. We select which agent is appropriate. The main superficial heat agents are moist heat, paraffin, fluidotherapy, infrared or infrared radiation lamp, contrast bath. And so you choose which one. You prepare the patient by telling them what's going to happen, put them in the correct position. Then you can apply the agent, assess the outcome, and document it all. Documentation, again, you do what area you treated, what agent you used, what parameters you use, either the treatment or, the temperature or the power, if it was insulated, the distance. So like if you're putting a hot pack on a low back, then you want to put how many towels you put in between or how many hot pack layers you put in between. So that the next person can also perform the same type of treatment safely. What position the patient was laying in and their response to the intervention. Especially, you want to always put it, but especially if they had an adverse response so that somebody else doesn't create the same issue. How do we choose between hot or cold? It's all based on what our goal is, what the issue is at hand, and how the patient presents. So if we are wanting to treat pain, we could choose either. Both decrease pain. If we're wanting to treat muscle spasms, we could choose either because both can help with muscle spasms. If we are wanting to decrease blood flow, vasoconstriction, of course we would go for ice. If we're wanting to increase blood flow, vasodilation, then we're wanting to go for heat. If you want to decrease edema, ice. Increase edema or increase blood flow to the area, heat. It's rare that I want to increase edema itself, but blood flow, yes. Nerve conduction velocity, if I want to decrease that conduction velocity, ice. If I want to increase it, heat. So typically I'll kind of heat before therapy and then kind of increase that nerve conduction velocity before they do exercises, and then ice to decrease that after exercises. Metabolic rate, of course, ice decreases it and heat increases it. The collagen extensibility, ice decreases, heat increases. This is another reason, like I said in the last lecture, that I don't typically personally use ice before I stretch. Joint stiffness, if you want to increase how stiff they are, use some ice. That's usually not one of our goals, but it is kind of a secondary outcome. But if you want to decrease joint stiffness, heat is ideal. And then with spasticity, ice can decrease spasticity. The book made this chart. This was on the recommended PowerPoint. And its statement is no effect on spasticity. Although I have always heard that heat can help decrease spasticity. So maybe we need to look back at the evidence and do some evidence-based practice and check and see. But I have personally seen both being used for spasticity, but the book would recommend ice. All right, if you have questions, please let me know, and I will see you in the next lecture.